Dental practices across Georgia are reopening now, months after they had to shut down, except for emergencies. Many of us have put off our routine checkups. The Fox Medical Team's Beth Galvin looks at what to expect the next time you end up in the dentist chair.
At Atlanta's Inman Park Dentistry, they're doing things a little bit differently. They're asking all of their patients to come in wearing a mask, and they can wait in the lobby or step outside or even sit in their car until they're texted. And once you go inside, you'll see the same staff, but with a lot more protective equipment.
Nowadays, we're wearing the masks, we're wearing face shields, we're wearing what we call cover gowns.
Dr. Alex Rodriguez's practice is now back open for routine dental care, or as routine as things can be in a pandemic.
Dentists, dental hygienists, dental assistants, by the nature of our job, we are at a lot of risk. You know, we are putting our faces inches away from everybody else's faces for half an hour at a time, and that's so contrary to what the rest of us have all been doing.
Rodriguez says he has spent the last few months searching for and stockpiling protective equipment, handling only dental emergencies for patients who just couldn't wait. And he says there are a lot of people whose dental issues have been on hold who need treatment now.
I think most dentists, that's our biggest concern, is that somebody that had something that was, close to flaring up on them 2 months ago. What is that like now? It's getting worse.
So as Inman Park Dentistry catches up on its backlog of patients, he says they're focusing on safety, not just for the patients, but for his whole team.
I know of at least one hygienist who I overheard her telling a story that when she was coming to work the other day, her son was like, Mommy, don't get the virus.
They're also checking patients' temperatures and vital signs as they come in to make sure that they're not infected with this virus, and asking them to rinse with a peroxide mouthwash before their treatment.
There's not a lot of hard science behind this stuff. This stuff is so new. We're trying anything that we think may help.
Rodriguez says they will be able to get back to business, but he knows patients are nervous too.
If they're concerned, if they feel like they're in a high-risk category, we'll reschedule. We don't have to have you come in right now, but there are plenty of patients who are very eager. Most people are very understanding. These are obviously not normal times.
And Dr. Rodriguez says after months of cancellations and delays, they are pretty backed up on their schedule. They're making appointments now for the end of summer. So it may take a while, he says, to get in to see your dentist unless you have an urgent problem. For your Fox Medical Team, I'm Beth Galvin.